Hello everyone, this is Dr. Mansi from Homeopathy 360, and today we have a great and a very special speaker with us, the one and only Dr. Ruchi Shirudhkar ma'am. A warm welcome from Homeopathy 360 to you, ma'am. How are you
Thank you.
feeling?
I'm good. I'm good. I'm feeling great.
Okay, ma'am. I hope these winters brings happiness to you, and this Christmas and New Year brings lots of love and warm wishes to you, all of you. So, ma'am, today we have lot of audience with us just because of you, because of your past work and your all hard work you have done in your experience for the homeopathic family and for the patients and everyone. So, hello everyone. Let's have a small talk first of all about Dr. Ruchi Shirudhkar. So, Dr. Ruchi ma'am, renowned research-driven homeopathic doctor, obviously known for her innovative and holistic approach, and she has been practicing since last 18 years and has beautiful and wonderful results with successful homeopathic treatments. And born to a family of homeopathic doctors, she is always aspired to be one. And from her educational background, she has completed schooling from St. Patrick's Junior College, Agra, and graduated from Bharati Vidyapith Homeopathic Medical College, Pune. She has completed ICR, that is Institute of Clinical Research, a full-time course from Pune. So being a rank holder all throughout, she has did exceptionally well in academics and co-circular activities like debates, dance, and whatnot. So our speaker is full of multiple talents and she has done great work in her experience. And the achievements and rewards are limitless. She has presented various papers and research papers at international and national level as well as she has given webinars several times, and most importantly, she has treated so many children. She has her own area and she has hold her own platform in the homeopathy. She also runs a YouTube channel with more than 11,000 followers and a Facebook group to impart knowledge to homeopathic students. So, ma'am, obviously, you have done various publications into various levels. Your achievements are really limitless. We are really inspired by you, and I hope all the homeopaths are very happy today because they have met Dr. Ruchi Shirudhkar live. They can have question answers with you. And also, we have a great topic today to discuss with ma'am. So, ma'am, you can now please take the platform.
Okay. Thank you, Mansi. Thank you for such a warm welcome. And Homeopathic 360 and BJN has been very close to me, it's very helpful platform. They are always ready to, support the speakers or new speakers as well. And they're doing a great work with all these free seminars. So it's very, very good, right? So coming to the topic, a very good evening to all of you. So coming to the topic of autism. Why autism? Why I chose this topic as autism. Can I pin my yeah, yeah. So if you have any questions during the presentation, you can please put it in the chat box. And in the end also, we can take the question and answers. So first of all, I'll start why autism, why I choose this topic, that case taking in autism. Case taking, everybody has talked. We have learned in our college, from the first year till internship, then why case taking? Because to be honest, I'm practicing now since 20 years actually. And with lots of failures, I learned ki the case taking and the vision that we want, we really need, I will not say want, need in autistic cases is very, very different as compared to any other normal case of cold and cough or bronchitis or asthma. Autistic ADHD children or conduct disorder children, we treat it very differently. So the case taking also is very, very different. And it is from my personal failures, we had lots of failures, and in spite of taking the case very well, in spite of doing all the hard work, putting all the rubrics right, we used to fail. And I saw the same kind of pattern with a lot of other homeopathic doctors also. And then we realized that, okay, we need to treat these cases differently. We have to have a different angle or a different vision in such cases, different eye you need to develop in such cases. So what we need to see, what we need to ask, that is very, very important. Okay. So I we all know that we see the peculiar thing in a case, right? Are you able to see the slide? Are you all able to see the slide? You can put it in the chat box, please. I'll put this chat box in the corner. Okay. So, when we talk about, we should know what is autism, what is common to the autism, what is, like if you have a patient who's come with sciatica and he says, I have a pain radiating down. So it is a common symptom of sciatica, right? You will not start searching that, okay, radiating pain is my characteristic. Or even if you take that symptom, you will not put it very, very high in your totality, right? So same is with autism. First of all, what happens is we all as individuals are not very aware that what exactly is autism, what are the symptom totality of autism. So first we'll understand very, very basic that what is autism. So primarily I would like to tell you that it's a spectrum disorder. What do you mean by spectrum? That it can be it ranges, it can be very, very mild to very, very severely autistic child. A few days back, I had a parent who said that, my child has some problems. Normal child goes to normal school, everything was normal. So I said, okay, what's the problem? Sometimes she's talking to her friends and she doesn't understand that they are not interested in her talk, or she would talk something very weird, or if someone is saying there's a death in my family, she may laugh. So the social cues she was not able to do, which is also a part of spectrum, right? So anybody who is not aware may feel, oh, this is why the parents are so worried and what is in it, or may get confused. So I will tell you and explain you each and every symptom of the spectrum first, and then we will go to the homeopathic angle, right? So it's a spectrum disorder. It ranges from a mild spectrum disorder to a moderate to severe spectrum. Earlier, this autism spectrum disorder was only called pervasive developmental disorder, later Asperger syndrome, and then finally we came with the word of autism spectrum disorder. Anything related to psychiatry, the best book to refer is DSM-5, which is Diagnostic and Statistic Manual, right? So what is in this book? They have given criteria. For example, everyone comes and say that, oh, I'm feeling depressed, I'm probably having panic disorder, or I have depression. But actually, if the person has depression, or is the person just feeling low, right? So there are criteria for it. You should be very well versed with these criteria in order to understand the diseases, the mental diseases we are talking about, right? So what is autism spectrum? So they have given 5 criteria, and each criteria they have given some points, right? So major is a deficit in social development, social interaction deficit, right? So when we say social deficit, what do you mean by they are not able to make friends? They are not able to have one-to-one conversation. For example, I just had a child. My last patient was on spectrum. So if I ask, Hi Devansh, how are you? So either they will repeat hi Devansh, how are you, or they would say something else. So basic communication skills is lacking. They are not able to, so and even the non-verbal communication like eye contact, hand gestures, body language is also lacking. So they will have poor eye contact. The body language is not as if they are interested in your, they'll be busy touching some things or very hyperactive, and they will not have appropriate facial expression. For example, whatever we are talking about, they may not have the appropriate facial expression to the talk. Are you understanding? And it is difficult for them to make up friends, or even if they make friends, if you see adults who are in low spectrum, they sometimes say, oh, I am not able to maintain my friendship, right? So that is also a part of social skills are not that full developed, right? It's a deficit. Now the second point is they will have repetitive behaviors. For example, a lot of children have sensory issues. Mothers, nowadays parents are very educated. They read on Google and they will give you terms. As a physician, you should be aware what do they mean by saying, oh, my child has stimming, hand flapping, oh, my child is on CF diet, GSCS free diet. Um, so when they use these kinds of words, as a physician, it's our duty to be well versed with all this. Are you understanding? So when we say repeated behavior, they can be like when they get excited, they'll be flapping their hands, visual stimming, and self-stimulatory behavior. They can take a pen and keep putting in their mouth, or they can take an object and doing something which is very repetitive, right? Or even repeating the word that you are saying, which is called as echolalia. How are you? They'll say, how are you? What you had for dinner, what you had for dinner. So this repetitive behavior. They can also have a typical voice, right? Look, and they will keep making the same kind of voice, a typical animal sound or any voice, or they may have a typical way of shrieking, right? So very repetitive behavior in hand flapping, or making a particular sound or repeating the sentence that you have said, which is called as echolalia. Second is they are very rigid to their routines. They will follow the same kind of food, will sit at, I sit on the sofa and eat, so they want to sit at the sofa and eat. Or they're obsessed with the chronological order. I have seen a lot of children, they take animals, suppose they take 10 animals, and they will try to arrange those animals one after the another in a circle or in a straight line. So for hours they can sit and keep arranging those animals, right? So, and they can have sensory issues, like they would have a problem with particular texture of cloth or a texture of an object, or they can be a hyper or a hypo response to touch or a smell or even noise. Some children will have fear of sudden noise, or they will not like very, even the food textures. Parents come and say, oh, he doesn't like a food which is very sticky and slimy. He would like to eat all the things which are dry and crunchy. So even the textures of food, they can have an issue, right? And the next point is that symptom must be present from childhood and not acquired later, right? Fourth point is, which is written for every disease in DSM-5, right? It is written that these symptoms should cause a significant impairment in social, occupational, or other important areas of functioning. Are you understanding? तो ये जो भी symptoms हम बोल रहे हैं कि social interaction नहीं कर पाता, या सेंसरी इश्यूज होते हैं, या स्टिमिंग होते हैं, या रिपीटेटिव बिहेवियर्स मिल सकता है, तो ये सब शुड कॉज अ डिफिकल्टी इन आवर डे टू डे लाइफ, इन आवर सोशल लाइफ, इन आवर ऑक्यूपेशनल बेसिक जो लाइफ है हमारी, उसमें ये हमें परेशानी करेगा, ये प्रॉब्लम. and it should not, ये जो भी symptoms हैं, it should not come into any other disorder, मतलब developmental delay or say conduct disorder, it should not overlap. So when you have these features, some of these features, say 5 of 7 or whatever they have given, then you can call a child is on spectrum. Is it clear? Anybody has any issues with this? So now what we see normally in our clinical practice, like children will come, first symptom that parents see very early is the delayed speech. कॉमन सिम्टम, बोलना बहुत लेट सीखा या बोल ही नहीं रहा है। तो जब बोलता नहीं है तो पेरेंट्स क्या करते हैं, कान के डॉक्टर के पास लेके जाते हैं, राइट। तो उसका ईयर चेक कराते हैं और पता चलता है कि भाई कान में तो कोई प्रॉब्लम नहीं है, सुन सकता है बच्चा, फिर भी नहीं बोल रहा। तो पहला फीचर जो पेरेंट्स को समझ में आता है कि लेट लर्निंग टू टॉक, राइट। सेकेंड चीज है, क्या पेरेंट्स लेकर आते हैं कि वो वर्ड्स बार बार रिपीट कर रहा है, वो बाकी बच्चों के साथ खेल नहीं रहा है। I take the child to the garden, but the child is not playing with other kids. ये अपने में खेलना पसंद करता है, right? ये ना घंटे भर तक एक टॉय लेगा और उसके व्हील्स को ही देखता रहता है. He is obsessed with one part of the toy. अभी recently I have a case where the child वो एक टॉय एनिमल्स लेता है और उसके जो पैर होते हैं ना एनिमल्स को, उनको ऐसे ऐसे करके हाथ से मेजर करता रहता है for hours and hours and hours. Giraffe lega, lion lega, and he'll keep measuring the legs. So they'll be obsessed with one part of an object, right? Any minor changes in their routine, they will get obsessed. Has obsessive interested. For example, a child may keep looking at the fan, or they keep looking at the washing machine when it is rolling. They will sit there and keep looking. Flaps their hand, very hyperactive, runs about, keep running in a circle, does not sit at one place, toe walking, has unusual reactions to certain things, right? So these are the common symptoms that the parents would come. Delayed language skills, delayed fine motor activity, gross motor activities, cognitive dysfunction, कि वो बाकी बच्चे तो पूरा ABCD पढ़ लिए हैं और इसको अभी नहीं समझ आ रहा है, but there can be children who have good cognitive skills also. Many a times autism is associated, or you can also have epilepsy, convulsions in autistic children, right? So you may have or you may not have. So we have materia medica where you have autism with convulsions and you have drugs which are for autism without convulsions, right? Unusual eating and sleeping habits, like एक ही पोजीशन में सोएगा या रात को बहुत पैर हिलाएगा before going to sleep, या gets very excited when we put him to sleep, always wants to play, does not want to go in the bed, does not want the light to be off. You can have different permutations and combinations. They can be anxiety, stress, social phobias, other fears can be associated, right? So now what a lot of parents come and ask, what is the reason? Why my child? What went wrong? Right? Why my child went into with autism? Yeah, he had this problem of spectrum. Doctor, what do you think? Why he ended up with spectrum, on spectrum? First, genetic. Any child in the family having autism or other developmental delay disorders, global developmental delay, conduct disorder, open and defined disorder, any disorder, that kind of history, if you get, it can be one reason. Elderly primary gravida, conceived at the age of 35, 37, there are chances of the child having spectrum. Certain genetic disorders, they can be associated with, like Down syndrome, Rett syndrome, very low birth weight. But I'll be very honest with you. Actually, why I started working on autism, I'll share with you. First, when I had a lot of failures. And second, exponential increase in the number of cases after COVID. And when I think why in COVID there is such an exponential increase in the number of cases, the only reason that I can think of is screen time. I have parents, you will not believe, I have parents who said that my child was on TV or iPad for almost 8 to 9 hours, and the parents have actually, said that, we are in IT and we have to work, and we were busy on our laptops, and there was no house help, and we did not know how to manage everything. So the only thing we thought is, we used to play the screen, or we used to play a nursery rhyme on the TV, and he used to keep sitting. And you will not believe, I have parents who said that हम लोग के पास ना ऐसे लर्निंग सीरीज थी, जैसे A for apple, B for ball. So you get those learning series, and the parents used to play those series for hours together, and the child was also happy. So they felt that, okay, we have smart TV, we are playing such music, he's learning. But gradually they realized the child is not developing, is not moving ahead, he's not developing speech. Are you understand? So I feel the screen time is the biggest culprit for the exponential increase in cases. A lot of doctors blame on vaccination, but I feel no, vaccination we were doing since ages, and almost 100% children are vaccinated, but still 100% children don't get autism, right? So there is something beyond vaccination. You will read books where they will, train you to detox every single vaccination you take, from MMR to DPT to BCG to everything. But honestly, it's my experience, totally my experience. There are few cases, yes, where you can blame it on vaccination. But most of the cases, if you ask me the cause, I would say either a strong stress during pregnancy, uh, or a abnormal screen time, or definitely genetics and everything, right? So now we come to the most important homeopathic point of view, which you all are actually interested in, is case taking. So how do you take the case of a child, right? So everything is important. I feel a well taken case is half the battle won. So what I usually do I will show you that also. So what I usually do is I have a pre-formed history form in my data. So anybody who comes with global developmental delay, or any psychiatric problem, or the child is on autism spectrum disorder, or attention deficit hyperactive disorder, any kind of these kind of disorders, if the child is coming to me, I have a history form, which is very much inspired by ICR, which is Institute of Clinical Research. So I have edited that form and made it more convenient for such kids. So I give that history form to children, to parents, and I ask them to fill it before they come to my consultation. So I'll share that form so you have an idea what kind of form it is actually. Yeah, so I have it here. Are you all able to see the form? So I have explained that why I need to take that history from the parents and why is it useful, so that they write in detail and with full honesty. And there is a preliminary information, which is name, age, sex, vegetarian, non-vegetarian, then a family setup, then the chief complaint. So what happens in clinic is, when a parent of a child who's on spectrum comes to the clinic, the parents are very much interested in telling you where they feel the child has a problem. For example, we have two kinds of parents. Parents who are very, very worried about that the child is not coping up, and there are the parents who live in denial. So I had a 6-year-old child, absolutely mute, no speech, and during the full case taking, father kept saying, he's just obstinate. He's not talking. He knows everything. He's not on spectrum. And it took me quite a while of time to explain him that this is not obstinacy. He's just not able to communicate, right? He said, it's all in his mind. He understands, but he's just not talking, right? So most of the parents live in denial, right? So they keep telling you, things that a child is able to do. For example, my child, he's 5 and he knows how to operate the mobile. He knows which channel to play on TV, but that is not age appropriate. Are you getting it? So listen to them carefully. Understand what happens to a parent when the child is on spectrum with full empathy, and then take the history, right? So to cut the time short, I give them this history form. So whatever they want to write about the chief complaint, they can write in detail. He keeps seeing the fan, or he gets very excited, he flaps his hand, or he keeps biting the objects, or whatever. He's not speaking, or he's not playing with other kids, or whatever. So there is chief complaints, and there is associated complaints, like any other complaint like constipation, he falls sick very often. All this is important. And I write the physical description of a child, emotional nature, whether the child is angry or has some fears. So we have specifically mentioned that, is the child shy, is anger, behavioral issues. So you have children who have behavioral issues, and there are children who do not have behavioral issues with spectrum. Okay. And the relationship with other family members. So you get an idea that, is there an emotional development happened, or the child is indifferent to everybody around? Any fears? If the child gets angry, how does he react? And how long does he take to calm down, right? Like किसी बात पे गुस्सा आया, तो बच्चे ने सपोज सामान फेंक दिया, तो does he get normal after a minute? Or for 2 hours he's shrieking and shouting and throwing a tantrum, right? Cravings, aversions. Does the child feel hot, so thermal? So we have made the form very simple, so that it's easy for the parents to jot it down. Half of our basic work is done in the history. Is the child constipated? Are there any urinary issues? How much does he salivate? Which is, we normally don't ask with other kids, right? How's his thirst, appetite, all the milestones, when did he started walking, talking, any stress during pregnancy, any medical condition during pregnancy, what was the kind of delivery, was it a normal delivery or a C-section, vaccination history, any past illness, any family illness, any reports, they say the child has convulsions, so any EEG report, or any other, they have done some score, they've gone to a counselor, whatever it is, they have to put it down, right? So any questions regarding the history form? Mansi, is it okay if we take the questions in between?
Yes, ma'am. Sure. You can take all the questions.
Any questions regarding the history form? ये तो form है जो preliminary patient लिख कर लेकर आएगा. It is mandatory in my clinic. Otherwise, I will keep taking the history for 3 hours. So to cut the time short, we have designed this form. So we give this history form when the parents come for an appointment or call for an appointment, and we make it mandatory to fill it as elaborative as they can. And I cannot put my patients' forms on social media, but parents fill it beautifully. And there are times when, from such a well-written history form, you understand that, okay, what remedy I need to give to this child, right? So a well-written, I always explain my receptionist would always explain the importance of, honesty while writing these history forms. Okay. Ma'am, if we can also get the recording of this. I think, Mansi, you will be putting the recording on YouTube, right? I think the recording would be put on YouTube. So the recording. Ma'am, can you elaborate on autism versus OCD? OCD is very, very different from autism spectrum disorder. OCD is obsessive compulsive disorder. So there is a thought, and you need to act on that thought compulsively. it is very, very different. There is no question of social communication skills being impacted in OCD. There is no question of non-verbal or sensory issues coming in OCD. So it's very different. If you still have questions, you can always go back and read DSM-5, which I strongly recommend everyone, because they are poles apart, to read DSM-5, which is Diagnostic and Statistic Manual for Diagnosis in such cases. What if only 3 signs in mild degree? So they have very specifically good. मैंने तो बहुत जल्दी में समझा दिया आपको, but go back to that book and read कि उन्होंने क्या बोला है कि 3 of these 5 signs must be present, but rest of the criteria must be present. So it depends. If they are matching that way, then the child is on spectrum, right? Any other questions? Regarding the history form, we have yet not, the patient has not come to you and we have not taken the history. It's just a preliminary form that we give to our patients so that we have a fair amount of idea of, what problems we have to, where we have to explore more in this case. Okay, anybody else? See, I am here to give this session because of Homeopathic 360, but you can ask as many questions as you want because I have really worked hard for such cases. How to differentiate ADHD from autism? There are cases where ADHD and autism can be walking together hand in hand, but there are cases where the child is not at all on spectrum and only attention deficit hyperactive disorder. Attention deficit hyperactive disorder is also of 2 types. One is attention deficit predominant, where the child is not very hyperactive, but cannot concentrate at while studying or something, keep losing objects, things like this. Or the second one is hyperactive predominant ADHD, where the child is very, very hyperactive, cannot sit at one place. Again, I would say, please go back to DSM-5. Can we ask parents to fill form when they come to clinic? No. Why? They can take their time and fill the form because the questions in that form is right about the stress during pregnancy. So sometimes if the child is 5 or 6 or even 10 years, sometimes parents have forgotten and most of the parents say, oh, it was a normal pregnancy, there was no stress. So I always say, take your time, just relive those moments and then write. So it is something not to be done in hurry. So please give them time to write the form. So everyone is asking a lot about diagnosis. So again, I would say, please read the manual. Please read DSM-5 so you know what are the criterias. Autism can be cured, depends whether the child is mildly autistic, moderate or severe. My answer to this question is the earlier you start, the better the results. So I have cases who are completely cured and they do not fall in any criteria. I have recorded follow-ups of parents where they said, the child is completely cured and they have no feature of autism. But I will again say, the earlier you start, the better the results. So my experience is, if I get a child with early signs, delayed talking, walking on toes, not interested with playing with other kids, I say, naam mein kuch nahi rakha hai, consult a doctor. And to see a spectrum child, it's not हर किसी के बस की बात नहीं, मेरे भी नहीं थी. Few years back, you have to train your mind to see those children to give better results. Okay. I'm running a preschool and more about treatment for autism. I also have a lot of kids having these, yeah. Okay. I think we have a lot of questions, but we can take these questions later. Um, So we'll come how to take the case. So the first thing, coming back to the case, because then we can take all these questions because these are general questions. Are you able to see the screen, everybody? Are you able to see the screen?
Yes, ma'am.
Okay, yes. So first thing is observation. What your mind knows, your eyes see. Your eyes cannot see what your mind does not know. So if I do not know that I have to observe this of the child, probably I'll not pay attention, or even if I see, I will neglect it, right? So first, what you see in a child is the shape of the head. If the head large, कुछ लोगों का सर बहुत बड़ा होता है, head large, और body बहुत पतली पतली, emaciation of neck with, emaciation of limbs with, right? So you have to observe the child from top to bottom. So there is a child कि मोटापा जो है सिर्फ अपर पार्ट ऑफ बॉडी में है और पैर पतले पतले होते हैं, मोटे पर पैर पतले पतले. What are the remedies? Ammonium mule, antin crude, और उल्टा है. The child is very emaciated from his trunk and lower part is well developed. What are the remedies? Anybody? So you have to see all this. I cannot see the chat. Yeah. So how is the child's physical makeup? How is his eyes? How is his nose? How is his teeth? Some people have, this bridge is not developed. We call it a saddle nose. There are limited remedies in this. Serrated teeth, you will see these kind of edges on the teeth, right? या yellow teeth हैं, या premature decay of teeth है. So this is very, very important, especially children on spectrum, because आपको जो prescribe करना है ना, वो visual stimming और hand flapping पे नहीं करना है. तो जो भी उसके beyond आप देख पाएंगे, observe कर पाएंगे, समझ पाएंगे, वो ही आपको remedy ढूंढने में मदद करेगा. So I had a child who had abnormal tuft of hair on the back. इतने बाल थे उसको. This is a child in my clinic. What are the remedies, if anybody can tell? What are the remedies? Suddenly, I'm not able to see the chat, Mansi. So there are two remedies, carcinosin and tuberculinum, who has abnormal hair on the back, right? So anything which is peculiar, which is strange. And then comes the history taking. What is history taking? We have the prior data because we have asked the parents to write the form. And now we have to ask parents, like, I always start, please tell me whether you wanted a child or it's an accidental pregnancy or you didn't wanted a child. Because there are different sets of remedies for such kind of issues, right? Next is, I'm closing this chat because first I'll explain and then I'll take the questions. Next is, any pregnancy में कोई disease थी क्या? Oh, I had thyroid. Were you any medications? I was taking Tylenol. Or, I was put on progesterone injections. Or, I need to see, yeah. I was put on progesterone injections. Okay. Any stress during pregnancy? My brother met with an accident, so my father died, or I had a history of 3 abortions, so I always lived in fear, or we met with an accident, so I was very worried that I would not lose a child, or there were a lot of fights in the house, or we as couple used to fight a lot. So these are the common things that I get in pregnancy history. It is very, very important. After the baby was born, whether the child was put to the breast or was, had jaundice, was kept on in the light or something like that, whether the child was breastfed, how were the milestones, when he started sitting, walking, turning in bed, such kind of things. Then we take history of vaccination, whether the child is vaccinated, what all vaccinations has been given. So their parents would give the basic vaccinations, polio, DPT, MMR, or something. And their parents would give everything that is available on earth, from influenza virus to rotavirus to meningococcal meningitis, and he's too heavily vaccinated. So please see what kind of vaccination. Is there any past histories? For example, the child is coming at the age of 4. So ask, are there any illnesses in the past? Oh, he had typhoid. Everything is important. Why am I telling you to take this history? The topic today is only case taking, right? So if you take the case properly, you will learn the next step, right? If you do not take the case properly, you may not know how to use it, right? There are children where parents would say, my child was all fine till 2 years. He used to smile, he used to babble, he used to even say mama. And I don't know what went wrong. He just stopped talking and he just started being in himself. These are called as points of regression, that till a certain age, the child was developing normally. And from this, so at this point of regression, what was the cause? Was it a vaccine? Was it an accident? There's a stress in the family or what, right? You also ask that the child loves the animals or not. Is there a history of dog bite or a cat bite? Or is there a history of head injury? Please ask. Right? So I have taken this in detail. Any medicines taken, pregnancy history, delivery, how was it? Was there any blood loss during pregnancy? Milestones, how were they? Because there are different set of medicines for spectrum associated with delayed milestones and not associated with delayed milestones. Is it from birth? What was the point of regression? All physical generals. Normally whoever knows me knows that I practice from my method, and I always talked about rubrics and observation. And look, I had studied mind and repertory to such great length that I can make, I developed, and I was proud about it, shamefully, I think now, that I can make rubric for everything that the child does. I used to vouch that there is nothing in the repertory that I don't know which is related to children. Every rubric I had studied so extensively because I felt that is the only way to reach or give a simillimum or to reach the correct medicine. And I really fall flat on my face when I started treating children on spectrum. So why I'm talking about spectrum on my YouTube videos, I'm conducting sessions on Zoom about treating spectrum disorder, where I show actual cases, cured cases, what remedies we give, because I had so many failures, because I had worked really hard in last, say, 5-7 years for spectrum kids, right? And I understood that if you want to treat such children, the results are miraculous. I'm telling you, they are miraculous, but you need to do it very, very systematically. You need to really, really work hard. It's not as easy as you treat a common cold. There's a lot of hard work, behind it, or to all the doctors who are successfully treating. So all the physical generals, I may not take in any other case, but if the child is on spectrum, I make it a point to ask perspiration, craving, aversion. So there are specific cravings for specific remedies. I gave an example of slimy food aversion. Naturally has very strong slimy food aversion. Could be चिपचिपा होता है ना, गीला चिलबिला सा नहीं खाता. Banana craving, Theridion has very, apple craving, Antiltat has a peculiar craving, salt craving. We all know Natrimute has very strong uh, craving for salt. A lot of children have craving for crunchy things, oranges, I had a child who used to love strawberries and tomatoes and cherries. And I realized that, okay, he's eating everything red, So all red fruits, you can think of and he used to like. So red, it's a very strong indication of chocolate as a remedy. So every remedy has different cravings and different cold food desires, veratrum. So this is very, very important. Lycopodium always wants his food to be heated. He will not eat if the food has turned cold. They like warm drinks. Phosphorus would like cold. Veratrum would actually eat ice, So such thing is very, very important, Whether the child is constipated, whether the child has recurrent infections, uh, recently I have got very good results in a case where there obviously is a group of symptoms that we are prescribing on. But the very characteristic thing in that case I came to know is when the child is straining at stool, trying hard at stool, he used to perspire, pura thanda pad jata tha, which was very characteristic of Viretrum. And there was definitely rest of the things also. And we gave Viretrum 200 single dose, and first follow-up, in 1 month, the parents said that he's 60% better. Believe me, all the children that I am treating now, I would say more than 70% of the kids, again, if you start early, you come to me at the age of 2.5, 3, I make it a point that your child be more or less cured. But if you come to me at 10 and 12, it's difficult. It's act. Maybe today I'm not, you do not get that kind of cure. This is my experience again. So position of sleep, if the child is verbal, then there can be dreams because he can voice out what dreams he is having. If the child is not non-verbal, you can only ask, does he startle? Does he get a frightened? Does he get a crying in the sleep? No, and then when you say chief complaint, how much importance do you give to these complaints and what importance you will give? So if you ask me, ये जो बेसिक कंप्लेंट्स के जो सिम्टम्स हैं ना, ये सिर्फ फॉलो अप क्राइटेरिया के लिए अच्छे हैं, right? So I'll give you an example of one failure case that I always talk of because I don't remember the name of the child. I would have otherwise called that child and said, please come to me, I'll treat you now. So I distinctly remember that child, that the child kept jumping and very hyperactive and little cruel with the pet that he had. And I kept giving importance, I I feel bad today because we failed at that case. I always said I sat and thought, okay, what is very characteristic in this case? I mean, I used to take jumping as my first rubric. Jumping, hyperactivity, and cruel towards animals or whatever. And I gave a lot of importance to jumping because he was used to jump like a spring. And I kept failing in that case until the child, dropped out. And I realized that you do not need to give importance to that jumping. You do not take jumping in your totality. You may not take what is visible to your eyes. You have to think beyond. A lot of importance to pregnancy history, a lot of importance to um, cravings, aversion, position of sleep, a lot of importance to physical generals, physical particulars, and less importance to observations, which we as homeopathic doctors, especially who practice through mind method, we give like, okay, gestures make turn head, the hand touching to the head, or gestures makes excited or hyperactive. No, you do not have to take such rubrics. So today I got the follow-up. I am treating a child. Um, she's in US and she's non-verbal. She's almost 5 years old. So today I took the first follow-up and the mother kept complaining, she bites a lot. She bites the window panels and everything she puts in her mouth, and she has a lot of sensory issues. तो उसने मेरा window panel का पूरा wood chaba liya hai. And believe me, I have not taken biting objects in my totality. I had given her a remedy, which if I tell you was not there was a lot of hyperactivity, flapping of hands. She used to come to my, once when they were in India, they came to my clinic, and she used to continuously do like this, continuously. Like she used to flap, take a book or my visiting card or something. Do not take this in your totality. Do not, she used to climb on my this basic table. Do not take climbing desire to, do not take jumping, do not take hyperactivity, do not take gestures of hand, do not take. I cannot tell you enough that all this is not very important for your prescription. Are you getting it? What all we described in the history, your prescription should be based on that. So why fit in when you were born to stand out? These are special kids. Treat them like special kids. Don't look down upon them. Understand the empathy. Understand the struggle that the parents must be going through. Understand what a family feels when you break, or when a pediatrician breaks that your child is on spectrum or has some disorder. We are parents, and please have that kind, not sympathy, have that kind of sensitiveness while treating such kids. Understand the frustration of a mother, especially when you are treating such kids. Okay? So this is all about the history. Now we come to the questions you have. Because आप हिस्ट्री लेना शुरू करिए अच्छे से, and then only you will be able to treat effectively. And then you should obviously know इस हिस्ट्री को इम्प्लाई कैसे करना है. इस हिस्ट्री को आपको मिल गया कि बच्चे ने whatever, the child was unwanted, or I had a lot of fear during my pregnancy, or my grandfather died and I was very close to my grandfather and I kept crying. But how to understand this history, कितनी importance देनी चाहिए अगर आपके बाकी के symptoms are not guiding to the same remedy. You know, you do not get those ideal pictures in your clinic. You get a very mixed picture. I always say that. And it's all about evaluation, what to put first. So if you see any case, if I show that I'm treating now, so for example, I'll actually show you a case which is having a very good result. Do I have, yeah, we have a repertory. So are you able to see the repertory now, everybody? If I pick any case, for example, that I'm treating, and I pick up the rubrics, you would see a very mixed picture, right? So you will see there are symptoms which are not covered, like there I've taken vomiting in pregnancy, banana desire, harmony desire for. So obviously a child of 3 years is not harmony, it's the mother. There was a lot of discords in the family, or stools lienteric, touch aversion to be children in. And if you see, I had given this child matrimule, which is the fifth remedy that comes in my totality. So it's always about evaluating that, okay, I'll put this rubric first and this rubric down, and what is important in this case. And this child has really responded well, right? Yeah, this is all about history. Any questions now? See, when we talk about medicines, I'll show you. Yeah, I kept it. So this is, you're not able to see. This is the list of medicines which I normally use for autism, and I'm studying almost daily these medicines because we are working very hard for such kids. So I have written almost 90 medicines. So there is a big set of medicines that we use. Each medicine has a different indication and a different group of symptoms you should think of. Mansi, can we take questions like live? If someone can ask, raise their hand and ask. Hello? Are you there?
Yes, ma'am. I think interaction through question and answer will be more interesting.
Yeah, so if they can raise their hand and then we can pick random doctors to ask questions as time permits, and then we can take the questions.
Yes, everyone, please take participate.
Because they have put a lot of questions, but it is very difficult to answer. So anybody who wants to ask anything, you know. So today I have talked about history because we are on an open platform. We cannot show our cases on YouTube with due respect to our patients, right? So I cannot discuss about और शो अ केस राइट और अगर मैं क्या होगा अगर मैं आपको कुछ बताऊंगी भी वो केस के बारे में तो केस कैसा आता है मिक्स्ड पिक्चर से आता है इट्स नॉट एज आई वुड से there will be 100 more symptoms in that case but I would have given importance to one thing, right? So that is what I'm telling you. Give a lot of importance to pregnancy history and physical generals if you take the learning from this session. So give a lot of importance to pregnancy history. Anybody who has any questions? You can raise your hand. We can, you know, there's nothing to be shy of or conscious about. Let me see what they have written in the chat box. How does one evaluate the symptoms? Can you share the 90 drug list? No, I feel you need to work hard and find your own list, right? It is everything. I strongly believe that we should guide but not give it on platter, right? So if you ask me from which are the most common medicines that come, yes, I can tell you 10, 20 medicines that come very, very commonly in autistic children. If you want to write it down, you can write Econite, Ignitia, Veratrem album, Natramure, Sulfur, Capsicum, Nux vomica, Tarantula, Tuberculinum, Theridion, Borax. I have given few Coffea, Ignitia. Ignitia comes very, very strongly. Medorinum, I cannot, how can I forget Medorinum? It comes very, very characteristically, it works beautifully. So I'll give you one tip, Syphilinum. So congenital disorders with history of psychosis, you think of Medorinum. Like child is born with some congenital anomaly, you know. Children born with Down syndrome, first dose Medorinum. Medorinum children, I'll give you one more tip if I talk about Medorinum कि parents बोलेंगे कि बच्चे को ना सुलाना बड़ा मुश्किल है, ये रात को बड़ा एक्टिव हो जाता है, इसको खेलना होता है, हम सोने जाते हैं लाइट बंद करते हैं, इसको खेलना होता है, ये ओवर एक्साइटेड हो जाता है. We think about lachesis as a remedy. Lachesis is also mentally active night. Give Medorinum 200 single dose and you'll see the magic. There are various other, they are typical cravings, they have sweet, salt, sour. Yeah, Medorinum is one medicine which probably likes everything. They have strong craving of oranges, unusual activity at night, congenital disorders, history of psychosis, parents may be having warts, fibroids, calculi. Think of Medorinum. Okay. How do you evaluate the symptoms? You evaluate the symptoms. What is evaluation? Is giving value to your symptoms. For example, I have taken sleeps position abdomen on. right? And I have taken craving banana, and I have taken perspiration forehead, and I have taken abnormal fear during pregnancy that there will be something happening to my fetus, my child will die, or there will be something, you know. So what you will give importance to? It's about giving value, which is very strong. तो आप उसको सबसे ऊपर रखेंगे, नीचे रखेंगे, बीच में रखेंगे, उसको evaluation बोलते हैं. सैडली ऑटिज्म के ऊपर बहुत सारी बुक्स नहीं है, बहुत ज्यादा डेटा नहीं है. There are few books which are helpful. One was Autism Reversal Toolbox, which talked a lot about vaccination. Honestly, there is a book by Judith and Ullman, which I would highly recommend, and which is called as Rage-Free Kids and Ritalin-Free Kids. You can go about. The problem with that, the book is very, very nice, but the problem with that book is nothing is given straight. So I must have read that book almost 5 times now. To understand what the writer is trying to say, you have to really, really read it again and again and come that, okay, why this writer had given XYZ remedy. Okay. There are so many questions on the chat box. I don't understand why people don't want to talk live. Okay. Because समझ नहीं आया last question में. मैम इसका आंसर मैंने दिया ना, क्योर भी होता है. इट्स और जो, तो मैं अगर अपना एक्सपीरियंस बताऊं तो जो बच्चे मेरे पास 2.5 से 3 साल के बीच में आते हैं, मोर और लेस दे गेट क्योर. Pediatric cases, I have been taking sessions for quite a few times. मतलब 2-3 साल हो गए हैं. We have taken cases on sessions on migraine, constipation, psychiatric disorders, rubrics. We took 20 sessions on alphabetical rubric sessions from A to, I think we have reached. We have taken every rubric, understood various remedies, various shades of remedies. For example, anger. तो मैं गुस्सा करके फिर मुझे बुरा लगता है, यार फालतू बच्चे को डांट दिया. तो एंगर ऑल्टरनेटिंग विद रिपेंटेंस. जब मुझे गुस्सा आता है मेरा चेहरा लाल हो जाता है, या एंगर के बाद मैं क्या करती हूँ, मुझे गुस्सा आता है तो मैं घर के सारे काम करने लग जाती हूँ, मैं जल्दी जल्दी अपने कपड़े जगह पे. तो एंगर विद इंक्रीज्ड फिजिकल एक्टिविटी. सो वी हैव टेकन, व्हिच इज ओनली प्लैटिनम. So we have taken various rubric sessions. I have taken sessions on autism also. I have already taken 4 sessions where we have talked about autism quite a few, but I am taking the next session that I have. I'm taking 2 sessions on autism. One is on 11th and one is on 25th of January. They are paid sessions actually. And you have to pay a certain amount of fee, which is minimal, say 900 rupees for these 2 sessions, where you will be seeing cases which has results or which has failure and what we need to, So yes, we keep taking sessions. You can follow us on YouTube, Instagram, Facebook, and then you will get, or you can personally message me also so that we can inform you about our sessions. So if you want to write my number, I'll write down my personal number also. Or if someone can write it down for me. So my number is 7875626071. So 7875626071. That's my number. That's my personal number. For appointment, we have a different number. So yes, so we take sessions. The idea is to train you. The idea is to come together and learn from our parents. Approach if mother had some history. Mother had some history, matlab Priyanka? What do you mean my mother had some history? So if mother is feeling neglected or if the mother had fears, so we have to take those rubrics and keep them high in our evaluation and give remedy accordingly. Yes, so if the question is, can we reverse if they, so I'll give you one more tip here. So if the child is born through IVF, there is one thing which happens, that is the mother is being given a lot of hormonal treatment. So you give these detox medicines also to mother. For example, there is a history of a lot of hormonal therapy. The child is born through IVF. You can give Aristolochia clematis as one dose. If the parent has some rheumatic disease and the mother was taking a lot of painkillers, you can give natrum salicylate as detox medicines for the bad effects of painkillers. If the child is on anti-epileptic medicines and the child, you can give homeopathic chlorpromazine as a medicine. This I have learned recently from Dr. Sarkar also. I attended his session on autism and developmental delays. So you have to learn from each one, always try to incorporate various approaches, always try to learn from various stalwarts, always try to read a lot of books. So I have also written a book. I have written a huge chapter on autism and I've given it to BJ only. Hopefully we'll publish it soon and then you can have it. It's an approach towards pediatric cases. So we have written rubrics, we have written therapeutics, and we have given a chapter on autism also.
Thank you so much, ma'am. And I think today all the participants have learned a lot on the autism. And I think all the question answers are answered. So, ma'am, I think
Yeah.
that
People were asking so many questions, and we have a big, number of doctors who are listening very carefully about.
yes, ma'am, and that's really appreciable.
Interest on treating autistic children, and they want to learn also. So,
Yes,
the
ma'am.
thing that you want to take from here is, please take the history nicely. Give
Yes,
importance
ma'am.
to the history
And as all the participants asked about the cases, we have to understand that every case is a individual. Every person is an individual. So we have to deal differently with everyone.
I just answered this question. Mother और बच्चे के rubric साथ में ले सकते हैं? Yes. So whatever mother is feeling, you can take fear in pregnancy, anxiety in pregnancy, and you can take craving aversions of the child also, right? आप एक साथ ले सकते हैं. Delusion neglected mother का आप as it is रखेंगे case में. Okay. So I'll give you, before leaving, we'll give some important tips. First, if you see a predominant grief in a mother during pregnancy, your first prescription should be ignitia. Don't repeat a lot. Give single doses. Don't need to, give LM and repeated doses. Single doses does all the magic. If you see a predominant fear that something will happen to my child, think of aconite as a remedy, as a primary prescription. So when we treat such kids, there are layers. So sometimes one remedy, but most of the times we have to treat it with 2 to 3 remedies, or maybe 4 even, right? So whatever is your totality at that point of time, give that remedy, wait for the result. I have waited for 4 months also, until and unless I see the minimum doses works magic. Don't repeat a lot. And don't try to treat a symptom. कि biting हो रही है या teeth grinding है, let me treat this. No, you will spoil the case. And only wait when you have results. I have seen doctors who are waiting, they have given calcarea carb and they are waiting, but result ही नहीं. हर patient जो मैंने ठीक किया है या मेरे पास आ रहा है, within a month, the parents say at least 30-40% improvement. If there is no improvement, that means your remedy was wrong. Don't wait for 5 months for some improvement. First month, the registration of the medicine should be there. Are you getting it? Which potency is best? So I usually give 200 single dose most of the time. Okay, I think we have taken a lot of questions. Yes, Mansi?
Yes, ma'am. I think that's all for today. And now it's time to wrap up.
Yes. So thank you, Mansi. Thank you, Homeopathic 360 VJ, for conducting this. And thank you, everyone. Without you, it has not been possible coming up in large numbers and, trying to learn. So we all are learning each day. Even I am learning each day. Every time I read a new remedy, I feel, oh, I didn't know this remedy. So we all study hard is the only lesson that I can, study very, very hard. Homeopathy is not easy.
Thank you so much, ma'am, for the guidance to the all students and practitioners. We have learned a lot today, and for the convenience to study again this PPT, we will upload this PPT on Homeopathy 360 soon in the academic section, and the webinar session will be uploaded on YouTube on Homeopathy 360 channel. You can stay updated. Okay,
Time
now, ma'am, it's
to
time to
leave, right?
leave. Yes, ma'am. Thank you so much, ma'am. Good night.
Night.